Senator from New Mexico.
Mr. President, I'm here tonight to join my colleague, the senior senator from New Mexico, and all of my other colleagues this evening on the Senate floor to stand up for hundreds of thousands of my constituents in New Mexico who will lose their health care coverage if Republicans repeal the Affordable Care Act and throw our nation's health care system into chaos. It's absolutely criminal for Republicans to strip millions of their health care without even a conceptual replacement plan in place. To my colleagues on the other side of the aisle, I want to make it clear that we'll fix it later simply doesn't cut it. They promised repeal and replace, and now they're giving us repeal and run. And that will cause chaos in our healthcare system. In my home state of New Mexico, according to the Urban Institute, an estimated 266,000 people will lose their health care coverage. This is not a change to their plan or a different premium. They will lose their coverage in its entirety. Thousands more of our state's 2 million residents will lose access to birth control and other preventative services and Medicare prescription drug coverage. Nearly everyone will be subjected to higher costs for lower quality insurance, especially those with pre-existing conditions. Dismantling our healthcare system would also put at risk many of the gains that we've made in protecting the 860,000 New Mexicans, 860,000 out of 2 million, who have pre-existing conditions like cancer, like diabetes, like heart disease. These individuals will be forced to pay more for their health coverage and possibly lose access altogether. This is not a game. This is a matter of life and death. And without any plan in place, this repeal and run maneuver will cause healthcare costs for all Americans to skyrocket. Dismantling our healthcare system literally means taking hundreds of dollars each month away from hardworking families. In my book, that's highway robbery. How? It's pretty simple. This reckless Republican repeal and run will strip away the tax credits that help many working Americans afford their premiums. More than 32,000 New Mexicans rely on those tax credits, which average about $200 a month, well over half of their monthly premium for health care coverage. Many of the sickest, many of the oldest, many of the poorest of our neighbors and family members will lose their health care coverage altogether. And over 20,000 New Mexican seniors will be forced to pay $1,000 more per year for their prescription drugs. Fixed-income seniors can't afford to pay more for prescription drugs. Dismantling our healthcare system is particularly problematic in our nation's rural areas, including much of the state of New Mexico. Last fall, I went on a multi-day rural healthcare listening tour across communities throughout northeastern New Mexico. Rural hospitals like those in Raton and Clayton and Santa Rosa are often the only healthcare providers for hundreds of miles in any direction. Under the ACA, rural hospitals agreed to exchange higher rates of insurance coverage for their patients for a reduction in reimbursement rates. In other words, they aren't being paid as much per patient as they once were, but the number of patients who come in without any insurance is dramatically lower. But now Republicans are going to take away coverage from 250,000 New Mexicans, but they aren't going to give rural hospitals their higher reimbursement premiums back. This repeal and run maneuver would cause many rural hospitals that already are operating on the margins to shut their doors or to simply turn away sick patients. Nationwide, nearly 700 local hospitals in rural communities face the risk of imminent closure. Think about that. That is nearly 1/3 of the nation's hospitals. Almost all of them would be forced to turn away patients if the Republicans move forward in dismantling our nation's health care system. In New Mexico, that would mean forcing many of my constituents to drive for hours to access critical, life-saving care. And it would also shake our state's economy to its core. Healthcare jobs were one of the few bright spots, economic bright spots in New Mexico over the past 6 years, particularly in rural communities. But this reckless plan, or I should say lack of one to be accurate, would throw our nation's healthcare system into chaos and scar New Mexico's rural communities for years to come. A community whose hospital shuts down may never recover. That's what's at stake here. Denying a family health care, denying a whole community health care, is reckless and immoral. Now, you might hear Republicans say that they want to tear everything apart now, but we shouldn't worry because they'll fix it later. But let me be clear. We have the capacity to fix and improve our current health care system in a bipartisan way, without throwing it all into chaos. But Republicans have to make that choice before it's too late. I would welcome honest attempts to find ways to improve our nation's health care laws, to make them work better for all Americans. In the past, I've taken the lead on common sense fixes to our nation's health care policies. In 2010, in the House of Representatives, I led the fight to extend coverage to the children of military families covered by TRICARE, up until the time that they're 26 years old. After hearing from many small businesses in New Mexico, I fought to repeal unnecessary 1099 tax reporting requirements for small businesses. And to this day, I continue to work with Republicans like Dean Heller of Nevada to eliminate the so-called Cadillac tax that would place an incredibly unfair tax burden on employer-provided health insurance that many working families rely on. Republicans need to put partisan politics aside and remember why Congress passed the ACA in the first place: to expand access to quality health care for all Americans. Before we passed health care reform, New Mexico had the second highest rate of uninsured citizens in the entire nation. I've heard from a lot of New Mexicans who have told me how access to health care coverage has impacted their lives, even saved their lives. I'd like to tell you just one story, one of those New Mexicans. Karen from Santa Fe is a registered nurse, and she's a breast cancer survivor. As a nurse, Karen has seen how health care reform and the reduction of uninsured and uncompensated care has helped community hospitals better serve their patients. But the real impact of health care reform for Karen has been personal. When she was diagnosed with breast cancer in 2002, Karen's insurance company dropped her coverage. When she had to pay out of pocket for her coverage, her costs doubled. As she went through several more recurrences of cancer, Karen went bankrupt. She lost her home. In a letter to me, she said, "Cancer is hard enough, but not to be able to afford my co-pays and appointments caused me so much stress it made me more vulnerable for complications." Now, today, Karen is able to afford health care coverage, even with her pre-existing condition. But Republicans are threatening to take that all away from her and from hundreds of millions of other Americans. Karen went on to say in her letter, no one should go without health care because of income. Good health is not a privilege for a wealthy few, but a human right. It's hard to say it any better than that. No American sent their elected representative to Washington to score political points and threaten the health and finances of hardworking Americans. And Republicans need to realize that's exactly what they're doing. What they're doing means chaos, means less health care. It's that simple. I wish we could be here today talking about pragmatic policy solutions to reduce health care costs and improve how providers actually deliver that care. Instead, and unfortunately, we're here trying to stop Republicans from turning bumper sticker governance into a very real disaster for thousands of my constituents and millions of Americans. This reckless effort threatens the very lives and the livelihoods of the people of New Mexico. Mr. President, I won't stand for that, and I know my constituents won't either.